Hello, everybody, and today we're going to be looking at the effects of exercise on the musculoskeletal system. So let's have a look, see what we've got. So by the end of this session, hopefully you'll understand the short and long-term effects of exercise on the musculoskeletal system. You'll understand about DOMS, delayed onset muscle soreness, and you'll be able to understand about the different types of exercise that are used in the treatment and prevention of osteoporosis and osteoarthritis. So let's get going. So let's think about the short-term effects of exercise on the musculoskeletal system. So obviously when you're exercising, the actual temperature within your muscle is rising, as well as in the core of your body temperature is also increasing. You get levels of that lactic acid build up within the blood system, and this can cause that kind of burning feeling within your muscles. But this, however, should clear within a fairly short time after exercise. So if it's a lactate issue, that's very short term. Joints also become far more mobile short term, and actually this is due to the synovial fluid that we've got round our joints, that the more we move them, that synovial fluid warms, and as it warms, it has increased flow and increased viscosity, so then we get increased range of movement. So long term, we've got an increase in muscle strength. We've also got the added benefit of our joints becoming more stable. And this is because the muscles themselves help to stabilize the joints. And obviously, the stronger the muscles, the more stable the joints are. There's an increase in both the number and in the size of those mitochondria in our muscles. And remember, the mitochondria are our little powerhouses that produce the ATP. So the more ATP we can produce, the more effective we are, and the greater amount of muscle contraction we can achieve. And then finally, long term, we're looking at muscles are able to become much more efficient, really. They're able to use oxygen and fat better and in greater quantities at any given time. So the whole system just works more streamlined, more efficiently, and can generate more power. So let's talk about DOMS. DOMS standing for delayed onset of muscle soreness. And this is any pain, muscle pain or soreness that happens from 12 to 72 hours after exercise. Now, remember previously I said about lactic acid, how that issues with lactic acid is short term, within up to an hour or so issue. So this is quite different from lactic acid buildup. And this actually involves, we think, little micro tears that occur in muscles that have been, worked harder than normal, or, to a greater, you've been doing something different to more intense exercise routine to normal. So you get the protein degradation, and that the protein, if you remember, we've got our actin and myosin. So you get small microscopic damage to the actin and myosin, and we get these changes in the muscle. But actually, after adequate rest and nutrition, the muscle will begin to heal stronger than it was before. So here we go. Here's just a little image. So we do our really intense physical workout, probably more than we used to. You kind of feel okay the next day, but then you get that pain following that. That's what DOMS is. So DOMS is really caused when you're starting something new. If you haven't exercised for a long time, or you're starting a new exercise program, that can be when you first feel it, when the muscles are just not used to that level of intensity. It can also happen when you start a different sport, when you change your sports activity, so the body's having to work in a different way. If you're increasing the time of exercising or the intensity, you might get DOMS. And also, this is a really important one to remember, activities which include eccentric training component, so that controlled lengthening of the muscle. So often if you think about, imagine climbing a mountain, it's the coming down part that can be really hard, and that can be the bit that causes all the aching the next day. So really, to prevent DOMS, you want to be thinking about starting any new activity program just gently and gradually, and allow the muscles time to adapt to any new movements to help minimize that level of muscle soreness. So, and also don't forget to include a cool down period, and the longer you'll need longer to cool down if the program is new to you. So just some points to remember to help mitigate some of the effects of DOMS. Okay, so we're going to move on to some of the bone issues that we might come across with exercise. And the first ones we're going to look at are two conditions called osteopenia and osteoporosis. And one is just the early stage. So osteopenia is just an early stage of osteoporosis, which is bone thinning. So if we think about the density of our bones, the measure of our bone mass is given as something called a T-score. And so what happens when we get our T-score? They look at what's an expected amount of bone mass and what they actually find in your bone mass. And that's measured as a standard deviation from the norm to find out the sort of the state of your bones, really. So osteopenia, it's where the bone mass is less than would be expected, but it hasn't quite got to the osteoporotic stage. So this is between -1 to -2.5 standard deviation from the norm, whereas osteoporosis is where you've got significantly reduced bone mass, where bones are becoming that fragile and brittle, that kind of honeycomb effect, and that's where it's greater than 2.5 standard deviation. So let's have a look at an image. So here we go. So this is the image of the neck of the head of the femur, and we can see on the left the normal bone density, and then osteopenia, where it's just beginning to look a little bit more honeycombed, and then osteoporosis, where you can see it looks a lot more fragile and less dense than in the other two images. So that's osteopenia and osteoporosis. So if you think about the kind of management that we want to look at, the exercise for osteopenia and osteoporosis, you're going to want to emphasize weight bearing because that increases bone mass, but obviously you've got to be careful in having anything too high impact because that could cause fractures. So you need to go gentle weight bearing exercise, so sort of walking, low impact aerobics. It obviously is going to depend on the level of issue with the osteopenia and osteoporosis. But the more you can get people gently moving in an appropriate way, you're going to reduce the amount of loss of bone mass. You're going to increase joint stability, improve that nourishment to the joints, and help support the symptoms of these things and lessen the likelihood of osteoporosis developing. So it's really important we get into good habits of weight bearing exercise for lower limb and upper limb, the early stages of our lives to prevent the onset of some of these conditions. So that's osteopenia and osteoporosis. Now another osteo we're going to look at is osteoarthritis. And this is a condition that causes gradual damage to joints, making them stiff and painful. And most usually it affects the hips, the knees, and the small joints in the hand. You can see issues with it. You can get swelling around the joints. It can be red and hot. It can be very tender to the touch, and you can also hear sometimes that kind of grating sound because it's bone against bone because there's been damage to the cartilage inside. So you can see a picture here. On the left, we've got our normal healthy knee with our normal joint spaces and healthy articular cartilage. Whereas on the right-hand side, this can be an image of someone with an osteoarthritic knee, sorry. And you can see how we've lost some of that nice smooth cartilage. So you're going to get bone rubbing on bone. We've lost some of that joint space. And also you get these additional bony spurs growing, which can cause pain and cause a reduction in the range of movement people have. So Arthritis UK recommends avoiding exercise that puts excessive amount of strain on joints and forces them to bear, heavier loads such as sort of high impact running or weight training. But it's really striking that balance, because you do want to have a degree of weight bearing, but you want to have lower impact exercises that are going to improve range of movement. So things like swimming and cycling can be good for arthritis, but also thinking about walking, maybe low impact dancing or aerobics, tai chi, low stress yoga, Pilates, anything where you're going to be getting some strengthening, some range of movement at an appropriate level. Another thing to note, though, just going back to the osteoporosis, that you need to take care to avoid activities that include bending forward from the waist or excessive rotation of the spine or lifting heavy weights, because of that potential damage of fracture as the bones are thinner. So do ensure that you get appropriate medical clearance to work with clients with these conditions. Here we go. There's just an image of things that might help people with osteoarthritis: Tai Chi, yoga, cycling, walking, exercising in the water, some lower level strength training, and neuromuscular training. So these are all researched, evidence-based ways to improve the physical activity of those with osteoarthritis. So there we go. That's just a quick look at the short and long-term effects of exercise on the musculoskeletal system. And we've looked at short and long-term effects. We've looked at DOMS. We've looked at osteoporosis and osteoarthritis. Well done. Thanks for staying with me, and have a little go at the quiz. Thank you.